And Dr. Chris Teichmiller joins us this morning. You know, your name is a little hard to pronounce.
It is.
But once you got it, you got it.
But I bet you've had problems with that all your life.
All my life. Typewriter, popsicle, Teichmiller. When I was playing baseball and I had my name on my jersey. Well, it was so long they had to curve it. And then one of the guys we were playing against said, "Is that your name or is that a disease?" So, I said it could have been either one. I had to step off. It was funny.
Dr. Chris T.
That's right.
Or you patients have to say, what do they call you?
They call me Dr. T or Doc or.
Okay. All right, you've been an eye doctor for how long?
27 years.
27 years. You ever have problems with your eyes?
I have. I've had to actually wear correction and wear glasses and contacts for most of the time, but I started wearing lenses at night that I sleep in that actually corrects my vision while I sleep. So,
Really?
so I don't have to wear glasses to see far away or up close.
But she don't like to be seen with glasses, so she thinks she needs to go back to contacts.
So it's kind of like a retainer for, like you wear a retainer for your teeth. Well, this is like the lens corrects in as your retainer. All you have to do is sleep in them at night.
Really?
Mm-hmm.
But she don't like wearing glasses.
I don't like
because
wearing
she said it makes her
glasses.
look old.
I didn't
But
say
she
that.
said, I
I
need to
just
go back
haven't
to
found a
contacts.
pair I
I said,
like
why
that
do they
much.
wear contacts?
Yeah.
It's because
Really?
they like to see, but
Yeah.
I didn't know that you just sleep in it.
Was that a new invention, or is that?
They've been doing Ortho K for 50 years, so but you had to wear them during the daytime. So only since about 2002 have you been able to wear them at night.
Now, the last time you were up here, we talked about dry eyes. I don't know if I've got that or not. I have to put stuff in my eye because I
You
have
have to
got
put
cataracts
drops in your
fixed.
eyes.
And is that considered dry eyes?
Well, sometimes it can be. You could have some floaters from the back, but then a lot of times the people report dryness as more they're burn or they're scratchy or they water. And so most of the time your eyes aren't producing enough oils, and it's the oil glands that atrophy away over time. And we're seeing an increase in that just because of all the extra computer or screen time that everybody's doing. Your blink rate goes down by 2/3, and so you're on computers 8 to 10, 14, 16 hours a day, so you're blinking only 1/3 as much as you should.
And that doesn't just pertain to older folks.
We're seeing a lot of that problem even in teenagers.
How do you fix it?
Well, first got to identify the problem and also work on blink exercises and warm compresses to make sure the oils work. Sometimes those glands are so stopped up, we have to unstop them, and there's a LipiFlow treatment that actually we do in the office that about 12 seconds, it's like a spa treatment for your eyelids, and it just releases all those glands, helps restore normal function to those glands, and we've seen amazing results from that.
You know, one of the worst things I ever had done to me was a tear test once. And they clipped a thing on my eyelid.
Now that's called Schirmer's. I'll give you that answer. Ding, ding, ding.
That was the worst thing I ever had done to me.
Yeah.
Did you ever do that?
I don't do it anymore. Yeah, they had a little. It was a little strip of paper, and you fold it and you put it over your eyelid, and you did it without anesthetic because that
it hurt.
That tests your reflex tears for sure.
Well, I had some reflexes, all right.
That's right.
It didn't do anything off of me.
Exactly.
But that was 20 years ago. But man,
that was back in the day.
What else can y'all do in your office over there?
We just do full scope eye care, so we take care of any kind of eye disease. We'll identify and work with the surgeons if you need cataract surgery or retinal surgery. We fit contact lenses, specialty contacts. We have a lot of patients that have irregular corneas due to keratoconus, or that's a kind of a bulging of the eye, or they've had LASIK surgery and it just didn't go well, and we can actually fit them with contact lenses to correct their vision and improve their
we're
eyesight.
scheduled for our first appointment with you tomorrow morning at 9 o'clock. What can a new patient expect when they come in? Now, I'll be a little different, but I mean,
He'll be a lot different.
when a new patient that's watching this morning, I recommend everybody switch over. What can they expect to come in from their initial appointment with you?
Well, that's a great question. We do take some extra time to get some information from you about what your lifestyle is. So, how much time are you from the computer? How much are you outdoors? What are your hobbies? Because just like
all that has a bearing on.
Well, because just think about this: how many women do you know that have one person, one pair of shoes?
Very good point. And don't say a word.
You have different.
Can we trade shoes in for payment on an eye exam?
You have different needs, so that one pair of glasses may not solve all your problems. You need polarized sunglasses when you're outside. You need computer glasses when you're on your computer. You need a spare backup pair in case you travel and you go.
Do you sell glasses too?
Right.
We have an optical that does do glasses, and we do contacts.
Huh.
And so then we're going to kind of take you through, and we do a lot of testing. And so the testing that we do, and a lot of people will tell me that they've had the best eye exam they've ever had, and they haven't even seen me yet. So that's because of the job we do and just doing the testing.
I think the best eye examination I've ever had from you. Now I ain't even taking it yet.
There you go. So
That's because you're going to get to meet the staff. They're going to get you through some certain things, and then you're going to meet
we
the
do a lot of
doctor again.
prevention too. So we take pictures of the back of your eye so we can look at your retina, and we can actually do early eye detection. So we have an eye wellness. It actually is like a CT scan of the retina. So we actually see the layers, and so we can pick up macular degeneration or fluid or diabetic retinopathy at an early stage.
Really? Is it hard to get an appointment with you?
Not if you know me. No, I'm just kidding. No, I'd say it's fairly easy to get in. We like I said, we block off appointments for patients to come in, that for new patients or referrals, and so we try to hold spots open. So usually we can get you in within 2 weeks' time.
All right. Well, tomorrow we'll be sharing some photographs with y'all on Thursday morning. Well, not Thursday.
You better
tomorrow,
warn
it's
the
Thursday.
staff.
No,
Next week,
they've already been warned.
So anyway, well, thanks for coming up, Dr. Teichmiller. It's
Well, thank
always
you.
a pleasure. You'll be a part of the program now. If y'all need an eye
gonna be
appointment, there it is. Innovative Eye Care, right there, Indicator on 6th Avenue.
You only have 2 eyeballs. Take care of
Yeah, you
them.
got to keep them too. So we'll be
Yes.
talking about other things up here. Thanks for playing along. Thanks for taking the eye test this morning.
Fun.
Thank you, sir.
You know,
You're not getting that
I'm
same
almost
one,
a Mensa
you know.
member.
Almost.
They can tell a lot by those eye exams.
Yeah, Innovative Eye Care, Decatur, Alabama. You sponsor on the program, and one of where we're headed tomorrow morning. Let you know
We'll
all
let
about
you
it
know.
next week. Thank you again, Doctor.
Thanks,
Good to
sir.
see Dr.
Thank
T.
you.
We'll take a break. D's up next. We'll check in with Cooking Carlos over in the kitchen too. Y'all hang on.